Absolutely. I think, if the greatest message I have today in here that you can take it to the highest level, we should develop pre-screening for the immune system and to determine whether or not a child can handle multi-viral vaccination. Is it feasible? As an immunologist, I'm telling you absolutely yes. Those methodologies are in place. We can take a drop of blood or a few drops of blood from the cord blood and test some of those cytokines, lymphocytes, and so forth, and see whether or not the immune system is mature enough, which in the future can handle the viruses. So we need to do something. That's the message that I would like to be delivered, hopefully from here to the highest level, which hopefully in the future that message will go back to the pediatricians, to give them the tools to do pre-screening and then vaccination.
And then I guess a follow-up to make sure that the antibodies...
And then follow-ups to see if they make antibodies. Absolutely, none of them are doing this.
Now, that would be your advice to Congress. Now, since knowing that all this will take time and money, what about advice to the parents, to the public? What can they do right now to protect their kids from this 1 in 150 roulette shot at their child for autism and all these diseases? What can they do if the pediatrician doesn't have time to evaluate their case histories? What do they need to look for? What should they avoid, and how could they protect their infants until there are these changes?
I think, if first of all, let me say the public are really very smart. They really have had the chance to work with the parents, with children with autism and other type of diseases. They're very smart. They read the literature. They understand it. If they can take the information and convince their child's pediatrician to postpone at least for 3 months, will be great help and can save some of these children from developing immune abnormalities in the future, including autism. Now that's a big if. I told you my own story that the pediatrician was completely opposing the fact that not to immunize or even postponing the immunization, because she was saying that she will go to jail. I don't think that's the right answer. Pediatricians are not going to go to jail if they will postpone the immunization. So the parents should be smart, look at the health of their babies, and if they see the child is healthy enough, eating well, smiling, then can take the child to pediatrician and do their immunization. Otherwise, wait 3 months and then take it to pediatrician. I'm going against the will of the pediatricians in here, but I think that's the only way we can help many children's immune system to be developed, so when they are immunized, not to develop some of these immune abnormalities.
And what about the cases of these multiviral loads, the MMR vaccines, the DPT vaccines? I've heard actually quite a bit about the DPTs being very dangerous. Since postponement will not resolve this issue, what can the parents do about
the multiviral could be absolutely, the answer is no. The viruses should be divided to virus 1, 2, 3, and 4, and should be given number 1 first. Wait if it's possible 1 month or 2 months, and then give number 2, and then wait another 2 months, give number 3, wait another 2 months, give number 4 and number 5 and number 6. That will be the most ideal way of immunization.
But since the vaccine...
Presently I'm talking about, because we don't have a way of pre-screening right now.
Is it possible to ask for these shots in individual...
Absolutely. Absolutely it is possible. How did they make them in the first place? They made antigen 1, they made antigen 2, they made antigen number 3 and mixed them together.
Right, but I mean, is it available on the market?
If the parents will demand that, yes, will be available and is available.
So it is currently manufactured individually. They can, if we request it, if it's demanded, it could be done immediately.
Absolutely.